All right, the second show short question that they're definitely going to ask you is why this hospital? Why not other hospitals? All right, I'm just kidding. So they're going to ask you why this hospital or why did you apply for this job? There are two ways to answer this question. The first way is in every hospital in Australia, there are different values, like four or five values. Make sure that you remember those values. Sometimes you can be asked this question and you should not be like, I don't know what the actual value is. All right, you're not gonna say that. All good? All right. You're gonna remember those four values. Like it can be something like compassion, respect, accountability, like something like that. And you have to say how the values of the hospitals can you can resonate those values with those of your own in terms of your professional and personal life. Let's say, for example, you can say that I can resonate the values of accountability that the hospital has with those of my own in terms of my professional life, because I always make sure that whatever work I do, I'm accountable to everyone. And you can give some example. All right, that's the first way of answering. The second way of answering is the same little camp structure, which is the clinical, academic, management, and the personal uh, personal things. So let's say the clinical skills, how different rotations within the hospital. If you have applied for a rotational RMO post, which I am thinking most likely, how different rotations will give you different clinical knowledge and skills and also will move you closer to the general registration. Academic, how you are interested in your research, in the research and audits of the hospital. Management, how you love to be a part of the multidisciplinary team and get to learn about the Australian healthcare system. And the personal space, where you can say about something like if the hospital is a rural hospital, how you love to be in a rural area, what excites you more being in a rural area, or if it's nearby a beach, how you love to be a beach person. So you can say something like that. All right, cool. Next question. Can you please describe me an example where you have effectively used your communication skill in the hospital? All right. As an IMG, whenever there's a word called communication skill, we often think about how good we are in terms of speaking English, but that's not the case. Communication skills means how effective communicator you are at the workplace in terms of delegating the tasks, in terms of escalating the cases, in terms of speaking with the patients of what the management plan is and what the medical condition is. Those are the communication skills and not just about how good your English is. All right. So for the communication skills, it'll be great if you can give an example of a clinical handover, which is the S bar technique. I would recommend you to watch the S bar technique video from Geeky Medics in the YouTube. It's free. Now you have to answer in a little format called STAR, which is the situation, tasks, and action, and the result or the recommendation. All right. Now for the communication skill example, you can also say things like how you did the breaking bad news to a patient, how you did the ARP or the acute resuscitation plan with a patient, anything. All right. Next, move to the next question. Very commonly asked, a mistake or an error that you made at your workplace with an example. So, definitely you have to make sure that whatever example you are giving from your past, you make sure that it's like you were safe at the end of the day. Also, it's not too minor that you're trying to portray as someone who is a perfect person. Generally, most people say about medication error or an error in when you delegated a tasks to a junior person and you did not ask about the competency of that junior person to do that procedure. At the end, the junior doctor faced some kind of embarrassment prior to doing the procedure, and you stepped in and you apologized to the junior doctor and the patient for not seeking the competency of the procedure, and then you made sure that you performed the procedure, and you ask the junior doctor if the junior person is keen to learn from you, something like that. With any error or mistake, you mention about, make sure you definitely mention about something called incident reporting. It's called incident reporting or risk man in Australia. You can also be asked about your teaching experience. So you have to cover, what did you teach, to whom did you teach, what were the teaching methods, what was the feedback, and how did you improve or learn from those feedbacks. We always mention that. And whenever you want to praise yourself, or you like to show your skill that you teach very well, always use sentences from the second person's point of view. Something like, the medical students told me that I teach very effectively, and they were highly impressed with the type of teaching that I did. They mentioned that the contents delivered were very effective and very clear to the point. Rather than saying, I'm very good at teaching, just say something like, the medical students have mentioned that I'm good at teaching. Something like that. That's the smart way of driving, I should say, driving the interview, and making sure that you don't appear as someone who boasts a lot about your personality, but also you want to show that you're good at it. So just use the second person's point of view in your sentences. That's it. For the medical and the surgical questions, I'll make a list of the important topics that the junior doctors generally get to see in the hospital, and they are generally asked. The topics like chest pain, acute asthma or acute COPD exacerbation, anaphylaxis, um, early pregnancy bleeding, postpartum hemorrhage, abdominal pain, post surgical complications, things like that. So, in all this scenario, what you are expected to do as a junior doctor, that's very important to understand, is that you should think like a junior doctor and not act like a senior person who can solve or everything. That's often considered as an unsafe doctor, as I've told initially. You take history, check the vitals, do basic investigations like ECG, bloods, do the examination properly, form a differential diagnosis, or form a most likely diagnosis and the differential diagnosis. You discuss with the registrars or the consultant and have a management plan. You are also expected to know what is the basic management plan for the patient, but you're going to say in a way that you are not going to do it without the approval of the senior doctors. All right. For example, following an ACS protocol, you definitely need to notify the senior and then you follow the protocol, rather than you initiating everything at first and then discussing the case with the senior at the end. That's not how it works. Also, sometimes you will be asked questions about things like, you are not competent to do certain things, but someone tells you to do it. What will you do? So, definitely, in any case, when you are not a competent person to do the procedure, you're definitely not going to do it, even if anyone forces you to do that procedure. Also, you're going to say that you will take it as a learning opportunity, observe it from your senior who will do the procedure, and then the next time you will do the procedure when you become competent by doing the training. You can also be asked about a difficult situation where you have to give an example of a difficult conversation with a patient, difficult conversation with a colleague. In those situations, also, you have to explain the STAR format: situation, tasks, action, and the result or the recommendation. The key is you remain calm. You don't react. If someone is angry at you, shouts at you, you don't react that way. You remain calm. You set your own boundaries, and you be professional at all times, and you be non-judgmental. That's very important. And you discuss the incident with your supervisor. You don't hide things within yourself. All right, it's very important. So this is a part of incident reporting. You just report it to the supervisor, whatever happened to you. All right. So during your preparation, um, make sure that you, in your from your real life example, you keep one example of how, like, an emergency case management, one example of a difficult conversation with a patient or a colleague, one example of how your way of communication has created a big difference in the patient's life. Make an example of a mistake or an error that you did and how you improved it. An example of a research experience. Even though you do not have a big publications, it's absolutely okay. You must have done at least a basic research in your community medicine posting during your med school as an intern. You can even say that. Those are the things that you keep in mind. You write it down. You memorize the script and you say it spontaneously, like you're saying it at that time. Because if you write it, you'll be more prepared, you will sound more confident, and you will be unstoppable to get your first job in Australia. At the end, I would like to say that if you don't get a job offer after your interview, that is absolutely okay, and it's very common for anyone to not get a job offer and to have heaps of rejection emails in the inbox. Take it as a learning opportunity, because you'll be definitely better in the next interview. I wish you the best. Bye.